People probably don't realize this, but over the past 2 or 3 years, the majority of people who use opioids in the community, illicit opioids, have switched to inhaling the medication as opposed to injecting it. So now 70% of people are inhaling the drugs outside in the community. And so we desperately needed a treatment that met patients where they were that was inhalable. And so Amin has developed inhalable diacetylmorphine, which we're producing.
All that has to be approved by Health Canada. So Amin met all of that criteria. He brought in construction workers, city planners, Dutch scientists here, physicians, nurses, most importantly, people with lived and living experience. So he designed the machines, he had them created in Europe, brought here, sent to our manufacturing facility, and then all of the structural engineering and mechanical engineering, including the HVAC, that had to be put together for all those machines to be assembled and to be prepared to work.
Well, Amin not only, he designed the systems, he didn't influence them, he designed them. So the entire laboratory pharmacy setup for the clinical trial was Amin's work.
We're here with the 10th anniversary since BC declared the opioid crisis as a medical health emergency. So my current focus right now is to see how can we take all the body of evidence that we have and transform that into treatment, and we're hoping that we can make that difference.
Well, I can tell you that it transformed hundreds of my patients' lives. Many people would stay on injectable treatment for months or even a lifetime, but most people use it as a tool to transition on to other things, the more standard forms of opioid agonist treatment like Suboxone or methadone. I have seen so many people who had chaotic lives, homeless, suffering, who with access to the medications that Amin was able to procure and make available and support getting evidence, whose lives completely transformed, who were able to find housing, access services, access care, some of whom have reconnected with families and some who are working. So thank you, Amin.
Receiving such an award doesn't happen in isolation. I've been working with many different individuals and institutions, from researchers, physicians, nurse practitioners, nurses, and so innovation isn't isolated to one person. It takes a community to innovate.
Nobody else has done it. Nobody else was willing to do it. We couldn't find anyone else willing to do what he has done to bring this to British Columbia, with the purpose and the goal of saving lives, of bringing back dignity, and giving people self-determination. Amin deserves this. Amin's on the right side of history. He's saving lives, and I am honored to be his colleague and friend.